Good evening. Thanks for joining us. I'm Dustin Lukey. Wisconsin's healthcare industry has hit something of a tipping point in its workforce where 13 of 17 medical professions have seen an increase in vacancy rates. Now, the past 2 years of the pandemic only adding to the problem. News 19's Joe Minnie spoke with local professionals looking for help.
The medical community is seeing an unprecedented workforce shortage.
Across the board in the 17 professions that we track, vacancy rates increased between 2020 and 2021.
The so-called silver tsunami of baby boomers means more health care is needed. Plus, other variables include a rise in retirements and COVID-19 disrupting the education pipeline. But Wisconsin's Hospital Association says the gap between those leaving and those entering medical professions has been widening for decades.
I think the WHA report is telling us what we have all been experiencing, is that the job market is very hard. It's hard to find candidates particularly for a certain group of roles.
The ripple effect of the pandemic only accelerated the problem.
In 2020, a new trend emerged. All of the top vacancy rates were those entry-level, frontline technical positions that not just healthcare, but all industries are having a hard time filling.
Healthcare systems have to get creative to attract and keep employees.
Healthcare employers have been working on recruitment and retention strategies to grow our workforce faster. And that's going to become even more important as our pool of available workers shrinks.
Gunderson has introduced a career development center to help workers explore all that medicine has to offer.
You can spend your entire working career here. You can come in, for example, as a medical assistant, and then we will help them find other healthcare careers. We think that's a long-term solution, is to help people really find these very rewarding healthcare careers.
In La Crosse, I'm Joe Minnie, News 19.
And Zank adds that even though the pandemic advanced the use of healthcare technology, there are still some hurdles keeping medical professionals from having more time to be bedside.